Hi everybody, welcome back. I'm excited to dig in about the cannabinoids. And my first question is really around CBD because that's one of the ones we have the most questions come in around. And it's that because there's these two different realms of CBD. CBD that has THC in it and CBD that doesn't have THC in it and thus is available in all 50 states. So first, please clarify for people at home what's the difference and is one more important or less than the other?
Well, what's probably the most fundamental difference between them is that they're being produced in a couple of different ways. So CBD naturally always has a small amount of THC that accompanies it. It can be very small, but it's always there. When you have something that is just CBD, like truly just CBD with no THC, that's usually been made by first doing an extraction of CBD-containing material and then an isolation and recrystallization, it's called, of that CBD to purify it into that purest form. So kind of fundamentally two different things. One is kind of more of a, in its natural form, and one is further processed to have removed the THC. In terms of the why or what is better about one versus the other, we're definitely observing some differences. Now, the presence of CBD only in a patient population is a fairly new thing. It's just been in the last couple of years that that's even been available to people. So there isn't as much patient anecdotal evidence around the use of CBD by itself in the absence of the other cannabinoids. It has been done some in research, however, in terms of animal model research where they've been able to isolate CBD and its effects. The traditional herbalist viewpoint on cannabis wellness and therapeutics would be that the whole plant and what we call the full spectrum of compounds that are in it, all the cannabinoids and all of the terpenes and everything that can be extracted from the plant is where you see the most benefit from. I've heard several clinicians comment that from their observations and their practices that they feel that CBD efficacy is at its greatest when it's accompanied by a small amount of THC. That may or may not apply to all patients or all conditions, so there's definitely more to learn about what are the effects or the implications of CBD by itself in the absence of THC.
And so the other thing that happens with CBD is they hear it's non-psychoactive, that means it's the most important medicine, so I'm going to start with that. What do you say to somebody who that's just their default answer?
Well, you know, CBD is great for specific ailments and THC is great for specific ailments. So depending on the problem it is you're trying to solve and where it is you're trying to get to and what are some of the maybe boundary conditions that you have may determine whether one is right for you or the other. But I've heard that also as well. They call CBD is the medical one. They both have a very high level of medical benefit. They're just different. It's one of the reasons why I say we have to separate the ideas of therapy and intoxication in some of my seminars, because we've often lumped them together, that intoxication means bad or not therapeutic. But THC definitely has a significant amount of therapeutic potential and assistance that it can bring to people.
And I think that a lot of times when you hear about the therapeutic benefits of THC, it's, you know, pretty severe cases like somebody who has cancer and they're using it as a appetite stimulation from the chemo, or they're using it as a relief from nausea. But I would argue that THC has a lot more everyday benefits as well that are not just for people who are reserved that are hyper sick. Do you agree, disagree with that?
Well, absolutely. You know, THC is wonderful for pain management. For example, so many of us, especially as we get a little bit older, have kind of everyday pain that we deal with. The over-the-counter and prescription solutions for that have a lot of side effects. You know, on the OTC side, over-the-counter side, it's often GI related. So when you take those anti-inflammatory medications, yep, and you just end up with a lot of GI issues. Many people get ulcers and things like that. You know, and so being able to have something that you can take that is non-toxic and doesn't have all those side effects is really an incredible thing, and we really need to learn more about it and all of the different ways that it can benefit people.
One of the things you said today, which I thought was really important to highlight, is that if you have if you get anxiety or you have anxiety, THC might not be the best thing for you. So if somebody is getting anxiety from THC, do you tell them to just cut it out completely, or is it sometimes strain specific? It's another question we get a lot, like, why am I getting so anxious with cannabis?
Well, it's interesting, the strain-specific question of it. There are certain terpenes and terpene combinations that can exacerbate those feelings in people. So it may not just be the cannabinoids, it could be the other compounds that are present as well. If somebody is experiencing anxiety from THC, and it's determined that's what's causing it, they certainly can seek to balance it with CBD. If THC is the cannabinoid that really provides the therapeutic benefit that they need, but they're struggling with the effects of anxiety or intoxication, coupling that in a balanced way with CBD, say in a 1-to-1 or a 2-to-1 ratio of CBD to THC, might be a great solution for somebody like that who doesn't want to stop seeing the benefits of THC completely, but needs to control their outcome a little more.
Mm-hmm. And even though I feel like you actually did mention it in a lot of different ways, the question we get often is, do I have to get high, right? So I want to use cannabis, and do I have to get high? And under this context of all these different cannabinoids, if somebody was going to say, I want to use cannabis without the high, what would be the starting kind of protocol you guide them towards?
Probably to two different areas of use. One would be acidic cannabinoid therapy, so using THC acid or CBD acid, both of which are non-intoxicating. Really lowers your potential for having any kind of intoxicating experience. There can be a small amount of THC present, though, so that's good to be aware of. And the other side of it would be CBD. For people who are really concerned about feelings of intoxication, I think CBD is a great place to start to see if it addresses the condition that they're trying to affect.
Mm-hmm. And do you have any concerns with the CBD that's coming from, the hemp plant versus the cannabis plant? And of course, we'd love your thoughts on that.
I wouldn't say concerns. I have a lot of questions. And it's just based on patient anecdotal feedback that I've heard so far. So it's only been the last couple of years, again, that we've seen a lot of hemp CBD products. And I think that one has to take that description very carefully because it's being used in a broad way to describe dissimilar groups of plants. So there are fiber plants, so plants that are, from an evolutionary perspective, have grown and developed to produce a lot of fiber and very little cannabinoid.
Thicker stalks.
Thicker stalks, right, that we call hemp. And then there's the cannabis sativa that we grow, this beautiful flowering plant that really is accentuated by these enormous flowers that it has on it, and high cannabinoid content. They're fundamentally
same plant.
They're genetically very similar, but they produce very different amounts of cannabinoid. The hemp plants are producing very little terpene as well. So what's interesting is some of the panels that I've been on recently and other patients that I've interacted with, they've told me that the only thing that works for them is hemp-based CBD.
That's nice to hear.
It's interesting to hear. Well, it fascinated me because I'd only been hearing the other side, which is it doesn't work for me, it doesn't have the same efficacy. And so I'm listening. Right now I'm in the mode of listening and absorbing information based on patient anecdotal evidence. It would be great to have some more formal clinical evidence, but unfortunately we don't have that in our hands right now. So I've definitely heard cases where they say it's the only thing that works. So I think that the jury is out. And again, I think it's not necessarily an A-B choice. As I said about acidic cannabinoids and neutral cannabinoids, there's a place for each one within our population of need for people who are seeking benefits from cannabis.
I'm really hopeful that hemp CBD yields good results for people because at least in the current kind of crazy landscape where we don't have safe access, at least it's something. So I've been hopeful of hearing more stories in the positive. So you did just mention something, though, about the restricted research, and also in your talk you said something that caught my attention where you said there is some permissible research happening right now that the government's allowing. Could you elaborate on that?
Sure. NIH is allowing research grants, which it didn't before, with a greater level of ease than previously seen. There have been actions taken to expand the production of cannabis that is controlled by the federal government that can be used in these federally approved studies. So that's really exciting. And one of the issues in performing good research has been the restricted supply. Bad product, yes.
Yeah, like in Mississippi, right? They've been growing this
Exactly.
basically terrible cannabis in Mississippi and using it for the trials.
Exactly. And so it seems that's going to change. So that's exciting, right? So when we get different cannabis and we have more varied cannabis and different types, THC dominant and CBD dominant, the possibilities for what we can actually do in those trials greatly expands. So I think that's a really important step, and thank goodness that they're making it.
Yeah, that's true. I do remember talking to somebody a little while ago that said, yeah, we've got some potential agreement to import our cannabis to Mississippi from Colorado or something. I was like, wow, That's a really interesting thing.
Yes, they are entertaining having it grown in other states.
Right.
Yeah.
I've heard that. So going back to the amount of cannabinoids, I think another question people have is there a target dose of cannabinoids that I should be aiming for in my daily regimen? Do you have any thoughts about that?
It's so individual. Depends on your age, your ailment, other biochemical indicators, what your sensitivities or propensities are. And I think that's very individual. When it comes to oral ingestion, there's been some agreement amongst clinicians and scientists of an oral dose, so a single adult oral dose is about 15 milligrams, 1.5, of THC or CBD. That's a good starting place for people who are looking at oral ingestibles, although I would say that many people who are not regular cannabis users, who are
15 is way too high.
15 is way too high, and it's more about 3 milligrams, which is where they would want to be. And so that small or micro dose format, I think, is going to become more and more popular. Again, as we have this greater environment of permissions, more people are coming to cannabis for the first time and taking baby steps as they try it. I think those 3 to 5 milligram low dose oral ingestibles are a great place for people to start. When it comes to inhalation and dosage, that's a little bit tougher because there's a big difference between smoking and vaporization. We talked about the 67% loss to the room in one of my seminars that shows that you're only getting about 33% of the cannabis that's in your joint if you're smoking and inhaling. So smoking is very difficult to even gauge dose or dose control. Vaporization, a little bit easier to do. There's a couple formats that you can have a dose-controlled vaporizing experience, whether it's with a Volcano bag system or something like the Humboldt dose pen that delivers it in a vaporized dose. There's definitely starting to be options around being able to dose control inhalation. They're just a little fewer right now.
Yeah. Do you think that, well, so let me say one thing. I've always felt that we have this population of people that are suffering from anxiety, depression, stress, that kind of thing, and that cannabis, whether it's THC or CBD, could be literally a perfect solution for many of them. And yet, I think that it's still such a large learning curve and a leap for people to understand the ways in which they can use these things to solve those issues. So what do you think needs to happen for us to really allow cannabinoid therapies to become a mainstream treatment?
I think a lot of the key to that is the delivery system. As I've interacted with more and more clinicians in traditional medicine, I mean in Western medicine and not in cannabis, I find that their major hesitation towards prescribing or recommending cannabis has to do with knowledge of the active ingredient content and the ability to have dose-controlled delivery so that they can write a prescription. Right? That's what doctors do. They write prescriptions. Take this amount of this many times a day. In its current formats, for the most part, cannabis is difficult for clinicians to identify with, to understand, and thus prescribe. So the more that we create delivery systems like the Humboldt dose pen that are dose regulated, that have defined formulations, you'll see a greater level of comfort in clinicians in recommending products and solutions like that for patients.
Mm-hmm. Yeah, it's true. I think as the dose thing becomes more well solidified, it'll become more accepted. So I think people hear a lot about THC, they hear a lot about CBD. You talked about some of these other cannabinoids, and even though you mentioned it, the inherent question that comes up is, well, where do I find CBDA, THCV, right? And just answer that question directly. Why is it that it's so difficult to find any of these other cannabinoids, really, besides THC and CBD, and now a little bit of THCA almost?
Mm-hmm. Well, there's a couple of reasons. Things like CBC, CBG, THCV, and CBDV are what we call minor cannabinoids, and they're called that because they're present in such low amounts. And it's the needle in the haystack where you have an appreciable level of one of those compounds in cannabis. So because of that, you're not going to find it in elevated levels in products because it's just difficult to get your hands on, so to speak, and to concentrate and to put in that kind of significant form. Now, there's more and more people who are discovering kind of new strains or phenotypes of cannabis that are elevated in these certain levels of cannabinoids. So perhaps I wouldn't say the near term, but in the mid to long term, there'll be more cannabis with those kind of unique cannabinoid attributes available.
Mm-hmm. Yeah, you hear a lot of people in the labs and genetics side talking about these cannabinoids, but you don't hear many people saying they've made like really good progress on any of these things yet, right? And is it just because the science isn't there yet, or, I mean, it seems hard to believe.
It's a lot of complexity. The endocannabinoid system and cannabinoids and terpene and the whole range of things we've been talking about here today, there's a lot of complexity, and it takes a lot of time to pull apart. One of the things that's tough about cannabis and correlating specific kind of cause and effect is that you're often ingesting a complex mixture. It's not just THC, 5 milligrams, or CBD 5 milligrams. It's 5 milligrams of THC with 1 milligram of CBD and all these different terpenes and all these other flavonoids and things in there. So
like every single one is unique to a certain degree.
That's right, and they all have activity. So it's really difficult to pull that apart, right, from the information that we have. And that's why in pharmaceutical, people take that approach of looking at a single compound, because to get the approvals and to understand, to be able to say it does this at this amount, they have to isolate it down and get to what we call that single molecule or single compound approach when looking at pharmaceuticals. And there's a big resistance to that in cannabis, because there's a significant part of the movement that is sure that whole plant is the most efficacious and has the most benefits for people, but is also the most difficult to correlate specific cause and effect with. Mm-hmm. So it's a quandary, and it'll be interesting to see how, as a therapeutic community and clinical community, we approach that problem to solve it.
Yeah, nice description. You mentioned terpenes. How would you describe the relationship between cannabinoids and terpenes?
Well, it's very synergistic. I think one of the interesting little factoids that not many people know are that cannabinoids are terpenoids. And I think that once you've established that, well, we're just talking about all about the same thing. Mm-hmm. They're the active ingredients in the plant, so to speak. They have activity relative to our own biochemistry. They enhance and influence one another's expression. So, for example, beta-caryophyllene can interact with the CB1 receptor. Right? So you have terpenes actually interacting with cannabinoid receptors. Not every terpene, but it certainly happens. So there's a very complex set of interactions. Different cannabinoids can upregulate and downregulate receptors with respect to other cannabinoids, right? So there's a lot of complex biochemistry happening in the ECS.
It's when you dig into cannabinoid science, you realize it's so rich with information and possibility and so much we don't know. What do you think is the next wave of discovery that you see coming that you think will be really exciting to the kind of medical or therapeutic community?
I think that it will be the adoption and the movement of cannabis into the truly medical realm. We're kind of straddling the fence a little bit still. Many of the people who are using cannabis for very serious conditions are doing so as kind of their last-ditch effort, their last hope, so to speak. They've gone through pharmaceutical, they've gone through chemotherapy, they did radiation, and now there's nothing in there at cannabis. I think it will be an interesting shift when cannabis isn't last in line
first
anymore, and perhaps it becomes first in line. So that could be an interesting shift.
Or at least used in tandem with first.
Exactly.
Exactly. That's really cool. All right, last few questions. You gave this whole presentation about cannabinoids. If you were to encapsulate it into one really important message or lesson you wanted people today to walk away with, what would it be?
Oh, it's hard to say one. I think it's important to understand that the reason that humans have such a strong response to cannabinoids is because we have this natural architecture, the ECS, that they interact with. Cannabinoids are an innate part of our biochemistry. It's not something foreign. It's something we have the natural architecture for. And I think that that concept helps break down the barriers related to drug use versus medicinal use. I think it's important that if people understand that your body naturally produces cannabinoid-type substances, the idea of their grandmother or their loved one using cannabinoids as an integrated part of their therapy regimen is less scary and less onerous. And so I think as much as we can remove the stigmas away from cannabis with the facts and information, I think is a benefit to everybody.
I think that's so true. I always like to ask people to reveal their own relationship with cannabis and how it benefits them and even why you're a user. So would you mind telling us a little more about you?
Sure, sure. I've been a cannabis user for 25 years. I enjoy cannabis both from a personal use perspective and a therapeutic perspective. I suffer from fibromyalgia and a few other conditions as well. So without cannabis, my days are racked with pain. So I use a significant amount of cannabis on a daily basis to control chronic pain and to keep my overall symptom level down. I also have a pretty stressful life. You know, I own a business and live in this industry, so to speak, which is churning, as many people who are entrepreneurs in it know, and is quite a bit of energy and activity. And so cannabis helps me relax at the end of the day and take my mind off of all those things and be able to have some more quality of life with my family.
Beautiful. And what would you say the cannabis movement needs most right now?
It needs leadership. You know, it needs strong leadership. It needs mentors. In a way. It needs people to help pave the way from where we've been to where we need to go. And I think it's those leaders and those mentors in the industry that are going to be the shepherds of success for those who are a little unsure about what are the next steps to take to move out of the darkness and into the light from an industry perspective.
Yeah. Sam, so nice to be with you here today. Really
Pleasure.
Enjoyed it.
Thank you so much.
We'll have you back again for sure.
Great.
Yeah. To all of you watching at home, thank you for tuning in. Gosh, I know I sure learned a lot today, so I hope you did as well. We will see you next time. Thanks so much, everybody.